We'll be starting off with Cre-du-Chat syndrome, also known as 5p- syndrome. But first, let's understand meiosis. The purpose of meiosis is to produce 4 haploid cells that are genetically different from the parent cell. As you can see from the drawing shown, the 4 daughter cells have half of the genetic information of the parent cell. Recombination, or crossing over, occurs in prophase 1 and metaphase 1, where homologous chromosomes are paired and lined together. The chromosomes in the examples are separated by size. As you can see, the homologous chromosomes are exchanging genetic information between themselves, resulting in genetic variability. On the left, we have prophase 1, and on the right, we will have metaphase 1. Being drawn on the upper right of the board is a pedigree of Cre-du-Chat syndrome. We will be discussing and going over the pedigree later in the video. Cre-du-Chat syndrome occurs for an unbalanced translocation that occurs on the small arm of the 5th autosomal chromosome, to the left. The unbalanced translocation occurs near the same time as crossing over, but does not happen within the same chromosome. You see, translocations, unlike recombination, occurs between 2 non-homologous chromosomes. If there is no net change between the amount of genetic information between the chromosomes, the translocation is balanced. As you can see from the example being drawn, there is a genetic change between the small blue chromosome and the big red chromosome, and they are non-homologous because the chromosomes are being separated by size. However, if there is a net change that is a loss or a gain, it can cause complications such as Cre-du-Chat syndrome. As you can see, the blue and the red have a different amount of genetic information on it. Blue has more and red has less. In this sense, this translocation is unbalanced. Having a balanced translocation does not affect the person with the translocation, but can increase the risk of an unbalanced translocation when passing genetic information to the next generation. As you can see here, the father has a balanced translocation, and so the son got the unbalanced translocation. Chromosomal defects can cause a multitude of complications. However, the most common ones include a cat-like cry upon birth, intellectual disability, microcephaly, small skull, and severe developmental delay. Others can also include circular face and weak muscle tone. There's no specific treatment for Cre-du-Chat. The affected parents must counsel with a medical professional based upon the symptoms present. The child must go through the physical therapy to make up for the lack of muscle tone, take counseling to improve communication, and is to be provided with special education.
Hemophilia is a disorder where the blood is unable to clot normally due to the lack of clotting factors. Symptoms may include large or deep bruises, joint pain, and blood in the urine. So the problem with hemophilia lies within its clotting factors, or coagulates. The blood clotting process relies on the coagulates, which are proteins in the blood and the platelets. The coagulation factors and platelets work in tandem in order to heal the damaged blood vessels and control breathing. The cells in the body, if affected by cancer, will be changed drastically, and the mitosis checkpoints will be completely ignored. As opposed to normal cells, cancer cells continue growing even when enough cells are present. This usually results in a tumor being formed in areas like your knees, ankles, and elbows if we're specifically discussing the possibility of cancer for hemophilia. Cancer cells usually ignore density-dependent inhibition, thus allowing them to continue to multiply more and more until nutrients are completely exhausted when they come in contact with other cells. With hemophilia, the cancer cells will not act as blood clotters and will not prevent swelling on areas and will be unable to prevent excess bleeding. Anchorage dependence is a good thing in terms of cancer because of how cancer can metastasize. Anchorage dependence will prevent the cells from moving onto other areas of the body. However, cancer cells ignore this. In correlation with hemophilia, if cancer cells were to be present, then the cancer cells would most likely have metastasized towards the area where the body has swelling, but won't function as blood clotters and will not stop the bleeding. The cells will transform with many abnormalities, like having abnormal shapes and having a larger and darker nucleus. Underlying causes are a group of inherited bleeding disorders along with a deficiency in clotting factors 8 or 9. For hemophilia, it will most likely be malignant because of how the coagulation factors will need to go to the area where there is damage at, so the cancer cells would metastasize towards there, a trait that only malignant tumors have. Treatments for hemophilia include clotting promoters, which will decrease the risk of the blood clotting. 50 to 60% of people will have severe hemophilia but can live a healthy life